India has administered the COVID-19 vaccine now, as per the latest data, to close to 90 lakh people in the last 32 days. Now, the government, however, has set a target of vaccinating 250 million people by July. That's 25 crore people that the government aims to vaccinate by July. Now, according to experts, India needs to drastically increase vaccinations because otherwise, at this rate, India is not going to meet the July target. As per the state-wise data that's been released by the Health Ministry, 8 states in India account for 57.8% of the vaccine doses. Uttar Pradesh alone accounts for 10%, over 10% of vaccines that have been given so far, followed by states like Maharashtra, Gujarat, Rajasthan and Madhya Pradesh. However, when you look at India's vaccination pace and where it stands globally, this is the worrying picture. As per data that's been gathered by the 14th of February, India has vaccinated only 0.6% of its total population so far. What does this mean for our fight against the vaccine? Let's take this to our experts. Dr. Gupta, if I can begin by asking you, if you look at the UK and India, UK is over 23%. And India still at 0.6%. Are we on track to meet that target? What does India need to do?
Yes, and this has been an issue in India. It has been an issue in the United Kingdom and many other countries. You see, the target is 60% of the population. You cannot effectively control the virus in community until 60 to 70% of your population has been vaccinated. I think the target that you set for 250 million in July is a bit unrealistic, to be honest, with the pace that is going on at this time, and with specific states being vaccinated more than others. I think that is concerning. But if you compare it to the United Kingdom, for instance, 15 million of the Pfizer and AstraZeneca doses have been given to the United Kingdom, but they approached it very differently than other countries. They decided, okay, we're not going to give the second dose immediately. We're going to delay the second dose and give it 3 months later, so that we can vaccinate as many people as we can with the first dose, so that at least most people have some sort of immunity to the virus. And it was an experimental approach. A lot of debate has been done over it in the scientific community around the world, whether it is the right approach or not. But so far, I think it seems to be working. And you'll see those numbers go down a little bit. So you won't see it increasing as fast as it has as the second doses of the vaccine start to be given in the United Kingdom. And I think other countries will then catch up to the UK in that respect. But yes, the pace needs to increase, and that would involve training more people to give the vaccine, setting up more centers, and actually getting it out to the rural communities where the virus may be spreading.
Well, the fact that we need to step on the effort to vaccinate more and more people, and we need to do it quickly, I think has been highlighted by all experts. But Dr. Srivastav, Chief of Neuroscience at AIIMS, also joins us. Practically, Dr. Srivastav, what can we do to expedite the pace of vaccination, because 0.6% is not taking us to our 25 crore target in July?
Yes, exactly. So I totally agree that this is really not going much anywhere. Said that though, so I've heard that, when they actually looked at what were the limiting factors, one was some problems, some hitches in the app, the COVID app was there. So the data which was fed and the data which was coming out, reaching out to people, calling out to people even for the second dose, there was some issues. So they're going to look into that. I think that needs to be looked into. The other is even in the healthcare facilities. It's now become mandatory that, you're being given deadlines. Like it was said that, okay, 25th February is your deadline. Please get vaccinated. After that, it is not going to be free. So I don't know. I feel it is unfortunate that we need to resort to do these things because it is voluntary and we need to come forward. And I think why people are not coming forward so very, voluntarily, so very effusively, I suppose is one. This concept that there is going to be a herd immunity, we already have that. Number two is that a lot of us do have infections, and since we've got infected, do we really need to be vaccinated? And that's being addressed to repeatedly, but that still probably has not percolated down. And number three is, the concerns about the vaccine itself. And actually, when you look at it, the ratio of problems with vaccine is really, really, really very, very small. But then that one case is getting highlighted, and that's probably all the reason why people are going, backwards.
Well,
so all these things, again, it will be awareness and awareness.
Yes, well, multiple reasons, and skepticism, of course, being one of them, but technical glitches also being, another impediment which has stopped us from accelerating our pace of vaccination. There is a school of thought that also believes, Dr. Mishra, if you'd like to weigh in here, that perhaps India needs to, sooner rather than later, make the vaccine available to the private market as well. Do you think that will go a long way in accelerating the pace of vaccination?
That is the way because government can only do that much. There are limitation of resources, reach, and more aggressive campaigning has to be done. It's the beginning days, the shortage of vaccine, giving to other neighboring nations. There are many other responsibilities that the government has. So probably they began the way they have now. So there is no harm in involving private players and NGOs, and then only the reach of the vaccine. As long as there is supply, I think then we can reach much larger population, and even we can follow more carefully the effect of the vaccine and the degree of protection that is doing. And we have to do that fast. If there is supply of vaccine, I think we should do it as soon as possible, in days and weeks. We should not wait for months, because more time you give the virus to hang around in larger number, bigger risk we are having that whole thing may become again out of control, because a variant comes which doesn't respect the vaccine, then we are back to the square one.
Dr. Srivastav, would you agree that the vaccine perhaps needs to be made available in the private market more easily, freely available for us to vaccinate more and more people in a short span of time?
I think I totally agree with Dr. Mishra. If there is a supply, then let the demand be met. I would say that only if the supply is not much, then you're going to prioritize and make it such way that, at a reasonable cost, it is going to go out to people who need most. But once you have adequate supplies, then the demand should be met, and that would be the way forward. Yes.
Dr. Gupta, any advice? What's it like, in the UK, for instance, there is a phase-wise dissemination of the vaccine there as well. But mass vaccination, opening it up to the private market, freely available, is that the way forward?
Well, I think it may have to be for India, but I think also one of the most important points would be spreading awareness. There has to be a concerted campaign from the government to actually spread the awareness. For instance, in the UK, we have radio messages, TV adverts in the middle of programming, and billboards everywhere, that are encouraging people to go and get their vaccine, which saves lives. And I think that effective campaign needs to reach out to the people. Otherwise, people can get complacent, which is probably already happening in India. And once these variants start to come in, then those people will not be protected just because they've had the infection before. So I think that it's a campaign issue. It's a more of a awareness issue. But yes, of course, it can be helped if the private partners come in.
All right. So a combination of awareness campaigns and, of course, the infrastructure to boost vaccine dissemination capabilities needs to be looked at. Remember, India, after more than 30 days of vaccination, has so far only vaccinated 0.6% of its population. The government has set a target of 25 crore vaccinations till July 2021. We're nowhere near that target at the moment, but thank you all very much.